Hey, good day all. My name is Darden. I'm a Facilities and Resources Team Lead here at Merchants Quay, Ireland. This is the open access service here in Riverbank building. You can come here, get your mental health needs met, your health needs met, whether that's through needle exchange access, through a doctor, nurse, dentist, and also we have a drop-in for clients, so clients that want to have some food, want to engage with staff around loads of different things, whether it's around housing, whether it's around social needs, social welfare needs. And we provide everything under the one roof here, and it's the only service in Ireland that you can come to and get all those needs met under the one roof.
So my role here is a nurse. It's an open access service, low threshold, so anyone, and I think this is the most critical thing about this place and most important, that anyone who presents at the door can come up here, see myself, see the GP, see the mental health team, dentist on Tuesdays and Wednesdays. We have a Hep C support worker. So we try and offer holistic care, whatever their needs are. We do what we can here because we're very much aware that they, for a variety of reasons, and I suppose mostly is they just feel that they're not welcome or wanted anywhere else.
Harm reduction, basically in a nutshell, is reducing harm, so clients will come here to access clean, sterile equipment. They'll also engage with a staff member. The staff member will then give them knowledge and around safer ways of injecting and using drugs, and obviously explaining to them the short-term and long-term dangers of using drugs.
So we deal with people just coming in emotionally heightened, very upset, and we can make the space for them to calm down, have a talk. Sometimes people just need to talk it out, and we're there for that as well. And those can be some of the most rewarding interventions when you can provide that therapeutic space for someone who, if they're on the streets, just doesn't have that normally. So yeah, very rewarding.
If you get someone who's come in off the street and they're having a bad day, and they get a nice cup of tea, nice bit of food, even if it's only a sandwich or a dinner, whatever they're having, and you get a smile on their face, that makes your day worthwhile coming into work.
If there's a young person after presenting to open access, I'll come down to meet that client, I'll do initial assessment, and then I'd work with what's going on for them. So there'll be a lot of information they give to me, so it's working with them on where they're at and what their needs are. So then I would have clients that I've already been working with, so I'd have to meet up with them and do appointments.
It's important that a service such as ours, dealing with people who have issues around addiction, homelessness, their health, both physical and mental, it's important that a service like this is located in an area where it's most needed. However, we do understand that just because we have a view that it's important that this service is here, for other reasons some people might not. So it's important that we respect our neighbours' views, work with them to deal with any issues that they may have around the provision of services here in Riverbank.
For everybody that comes through the doors here who are in addiction, there's a family there behind them. Mum, dad, brothers, sisters, aunts, uncles, and indeed the wider community. They have never asked to be part of this crazy world of drug misuse, but find themselves thrown into it and really struggle to cope with drug misuse in their family. We sit, we listen, we talk to them. We try and find out what it is that we can maybe do to make things a little better. And then we invite them to join the group, where they meet people who have experienced and are going through the same issues as they are.
There's a lot goes on within Merchants Quay. It's not everyone coming in will need a doctor, but they might need a hostel, or they might need a payment, or they might need a dentist. So it's just building that trust and respect with the clients. And I think we probably get on average about 100 people a day coming through the service. If not more, from all nationalities, from all over the world.